Hello there. Happy Friday. Let me bring in Brittany Kim, the CRPS PT, here to join us. Discussion with Brittany and Julie all about pain. Today we are talking pain and perception, and look at how fast we are making this happen. Like every time we're getting so good. This has become a little Friday lunch chat for Brittany and I, and we've got all sorts of folks joining us live too. Thanks so much for coming live. I think maybe we need to make our Friday lunch chats a regular thing, Brittany.
Yeah, that'd be fun. Yeah.
We kind of have over the past few weeks, but hadn't entirely planned on it. So maybe we will plan. And for folks that join us live on these too, feel free if you have questions, comments, go ahead and put them in the chat. My dad is here joining us live, Brittany.
Hi, Ron.
I know, we have to say hi to my dad. I'm very lucky that Brittany has been able to help my whole family with all kinds of things. So that's great. But we kind of come up with clinical topics that are frequently asked questions by folks in our community, whether that's brain bites or here online or at the clinic. To be honest, we get a lot of questions amongst our whole team, and pain and the perception of pain and a person's whole experience of pain in their life is definitely a big topic. And when I was reaching out to Brittany for our chat today, she was like, oh my gosh, you have to look at this article. And this is how Brittany and I end up down rabbit holes sometimes, is by looking at this article. So one of the things that I love to do more than anything is actually read a good article. And I have to say, this one is even pre-print. It hasn't even been through the review process. It even has a thing at the top that says, these should not be considered conclusive, right? So I'm going to make that disclaimer as we talk about this article. It's a qualitative study, so I'm not too concerned about all of the statistical rigor that is happening here. It's more about really getting people's perspectives and then reflecting on that for ourselves as clinicians. But if you are not on our newsletter, get on it. I'll send out a link to this pre-reviewed article called Illness Perceptions in People with Chronic and Disabling Non-Specific Neck Pain, a qualitative study led by an awesome group of folks across the world, really. And we're going to chat about it today. So I have like my highlighted copy over here, Brittany. But I wonder first if this was a qualitative study, and look, somebody's joining us from Australia. How wonderful. Glad to be here. A qualitative study, it was actually done in Amsterdam, right? I noticed that their outcome measures were in Dutch, for example. And so questions as we think about talking about this study is like, why would somebody do a study like this? And I think it's a really important study to really get at understanding qualitatively people's experiences. But I'm even curious, how did this study pop up on your radar? Why would you read a study like this?
I have little email alerts set up. I follow some of the authors. This is like a hot tip for any of you who really want to be up to date, is just set up little Google Scholar alerts and follow people you like following. But I particularly love qualitative studies because I think it gets at the more like humanistic side of what's going on. Like it asks the questions that I think people want to know, because that's, I think, what life is like in the clinic. Is it's really a human interaction, right? It's between two human beings, and like understanding who this person is, what their experience is like. And I think for me, I think Julie and I, we have a similar background. Like in undergrad, one of my majors was a sociology major. So I particularly love qualitative studies because I had to do one in undergrad, and it was really fun to do and to like understand the connections between people and their mindsets and like the understanding of their experiences. And so I find that these studies are really valuable for me as a clinician because I only know my life as a clinician. Like I'm someone, I don't have CRPS, so I don't know what it's like to have CRPS. So being able to read a study where they interview multiple people and we understand like their lived experience is very valuable. In the study, it's chronic neck pain, and there's a lot of people with chronic neck pain. I think just hearing their experiences, it's like, I mean, maybe Julie, you can agree with me. I feel like literally some of these quotes are things I've heard from so many people with any type of chronic illness or condition that seems like a quote unquote mystery, and just the struggles and challenges. So for me, I think it brings connection, so I have better understanding of what people experience, but also I think it's nice to share with people to like people you're working with and say like, actually there's a study and literally someone else said the exact same thing that you said, and this is what they found was helpful for them through this study. And so yeah, I really appreciate these kinds of things. They're
Yes.
just so interesting.
They are. They
Yeah.
are. And
Mm-hmm.
I'm totally with you on that. And I was even thinking the same thing. When they actually, that one nice thing about qualitative studies is they have
Mm-hmm.
the quotes from the person
Mm-hmm.
who is experiencing this. And there was one person in there that I was like, oh, I feel like I hear this a lot. They're like, I'm a bit older, I've been active, and now I have these complaints. My parents are the same as me, they've had these same things. um and they're kind of like, they said, old age is coming, my body has had a lot to endure over the years. And I was like, yes, I've heard that. I have felt that myself, like I've said that to myself. I was actually really feeling these people. Another person said, I think it's because of stress. The past 40 years, this person, were stressful to me, and I think this has had consequences on my body. And I found that so meaningful too. Things accumulating over time. But those are two very different experiences, right? And how the person might be making sense of things that have contributed to their neck pain.
Mm-hmm. Yeah, and I think that's what I really like about this article is the other big focus on it is the concept of sense making of the person's condition and where that comes from. And that's through interviewing all of these different people and understanding like how do they make sense of their condition, and then what do they then do about it, and how do they cope with living with this chronic condition, which I think brings a lot of insight into like how you might choose to educate someone, how you choose to communicate with people. And yeah, I know Julie and I, we've talked a lot about like listening is, I think, the number one like skill that you can have to make a huge impact. If you're not listening, you're going to miss so many things, and it's going to be more challenging for sure. Mm-hmm.
Yeah, yeah. Brittany and I talk about this a lot, and there's a lot, in the world for physical
Mm-hmm.
therapists, for occupational therapists, about pain neuroscience education.
Mm-hmm.
It's even PNE for short. And I think, um, in some senses, like people think that's a thing, right? Like one thing that you
Mm-hmm.
would do. And when I read this study, I'm like, this is the start. The listening is the start. The understanding is the start. And you don't just kind of like throw a workbook at somebody, or just spew all of your neuroscience
Mm-hmm.
knowledge, which I've
Mm-hmm.
totally been guilty of because I just love
Nerd out.
the
Yeah.
neuroscience knowledge, right? But it just like
Yeah.
comes out. But it's really understanding the person and meeting them in their own understanding.
Mm-hmm.
Yeah.
Mm-hmm.
What were some of the things? I know they kind of had themes that came out. I'm kind of
Yeah.
curious of what you found like interesting in some of the themes that came out of the study.
Yeah, I think I have the article pulled up because it's just, I mean, there's so many. I was like literally pasting, I practically pasted the whole article to Julia. I was like, I could
I
stop
know you
pasting. I
did.
was like, and then this quote, and then it was like, okay, the end. I could just read the article. Um, but the idea of theme 5 here, like along the road and perceptions and experiences. And just kind of like exploring people's perceptions and experiences a little bit more. The thing that really stuck out the most to me, and I think because we see this a lot, I think at Reactive in particular, um, is like it's almost like they kind of broke it up almost into two kind of different types of people. I think there's probably like a very big spectrum, or like also different journeys, and you're in different parts of that journey. But this idea of like trying to make sense of what's going on and then cope with it. So in the example that they gave here, this kind of there's a theme that there were some people that were on this path of like trial and error, and then it just led to a lot of negative emotions and feeling really powerless in those things. And it makes a lot of sense in those kinds of, if you were to really think about it, it's like I saw this doctor, they didn't know how to help me. Then I got passed on to someone else who didn't know how to help me. And then you start thinking like, no one can help me, or no one understands. Like this must be so big of a problem that like it's not just easily fixable, right? And then the quote in there, just like I feel like I've heard so many people say these different quotes, like where the person's like, I visited this person and this person, I tried this, that didn't really work for me, maybe I need another treatment, another diagnostic assessment, maybe I need, and this person is sitting here like desperately trying to solve their own problem. And I think for me as a healthcare professional, it's just like so hard to see so many people go through so many of these, like the healthcare system, and then get punted around. And I think I just wish there was more awareness of some of the conditions that we see, because the other big part of this article is that part of the sense making, the people, like part of your sense making process, like what's happening to me, also comes through interactions with other people. And a big part of that was actually with healthcare professionals. What healthcare professionals said to people influenced their beliefs about what was going on and their experiences. And so I think this is a big challenge for us to make sure, like, are you up to date, right? Like, are you really listening and trying to understand this person for who they are and their full experience? And then how do I help, guide them onto their next steps or what they need, and do that in a way where I'm not just shuffling them back into the healthcare system. Right. I wish I could prevent that.
Yeah,
I don't know how
yeah.
to do that, but I wish I
Well,
could prevent
that's why
it.
we
Yeah.
are here
Yeah.
talking about it. I mean, such a big
Yeah.
mission of ours is to
Hmm.
share this with other clinicians so that when people are on that path of searching and looking for answers, they can find more people that understand some of the complex pieces that go into even something I want to say as simple as chronic neck pain.
Yeah.
I know it's not simple, but for a person that typically sees somebody with about 24 diagnoses, this actually seemed a little simple. But I want to reshare the name
Yeah.
for a
Let
person.
me, or yeah, I can share. It's called, it's not peer reviewed yet. It's in the process of that for the BMC journal. Illness Perceptions in People with Chronic and Disabling Non-Specific Neck Pain, a Qualitative Study. And there's a couple of like really big authors on there that I personally love following, like Copy Tears and Peter O'Sullivan. So I feel like yeah, their stuff is just really interesting because it combines that like biopsychosocial piece into especially like chronic health conditions, and they focus a lot on spine research as well.
Yeah. And
So
we've learned, I mean, we've learned a lot. I follow Peter O'Sullivan on Twitter, and I just kind of lots of interesting insights in this like overlapping realm of kind of what I would say is like an integrated care
yeah,
model,
yes, yeah,
to be honest. And one of the things that I definitely see, I get to work with a lot of people in their consults, and then even like work with our teams working with people. And this came up as a theme here of like the people that you talk about when they feel really lost or confused about what's actually going on. I forget what the quote was, but maybe it ends up that they're leading down this path of multiple
Mm-hmm.
tests and maybe actually getting several different potential explanations.
Mm-hmm.
My experience with people going through that, it's so stressful and
Mm-hmm.
confusing. And it can be really hard as a physical therapist or occupational therapist or psychologist working with a person at that time, because you're also trying to make sense of all of
Mm-hmm.
that, right?
Mm-hmm.
And I'm curious what I know you've been with people down that pathway too, and they're like, well, maybe if I try um, this epidural, and maybe if I try
Mm-hmm.
this, and maybe if I try this, and at the same time you're also working on other pieces. I'm kind of curious for like the clinician perspective, how do you help somebody navigate in a lot of uncertainty?
Mm-hmm. Yeah, I feel like one of the things that I've just learned over time, with a lot of the different kinds, I think when you're working with conditions where there isn't super strong research saying this is the answer, right? Or there isn't really a one fix all solution. And then I think it's human nature for us to only have one problem and one solution, right? And
Yes.
but I also, like, through my clinical experience, have seen that for some people, something that I never heard of before, I never would have considered, like, it works for them, right? And for other people, it doesn't work. And so I feel like combining those things together, I've learned my role is, I've taken the pressure off myself. I think we feel like we have to provide them the right answer. That's not my role. Like, my role is to, like, go back to listening, like, listen to what it is that they're concerned about. And I've found that, my job is to, um, or I guess I should say first, like, it's up to that person to make the decision, because it's like their body. I don't live in that body. Like, I don't know what it's like to be in that body. Like, it's important that they make that decision. I don't have the money they have or don't have, right? Like, it's like there's so many factors that go into that. And so I see my role as providing them just strategies in making better decisions for themselves. So it's kind of like, did you ask that person what the consequences would be? Like, if you were to have that procedure, like, what are the outcomes? Do they have like 100% approval rate, or is it 3% approval rate? Like trying to empower people to advocate for themselves to get the right treatment that they want. And it's up to that person if they want to take the risk because they think it'll work. It's like, that's their decision, and I have to, like, support them in that process. I and I'll just share, like, oh, someone I know did that and it seemed to help them, but it's like the answer is, like, I don't know, like, most of the time in these kinds of situations. But I think if you're a clinician and you feel that pressure, like, I think the best thing to do is think about how can you empower your clients to ask the right questions so that they can make the best choice for themselves. And then, I mean, the only time I'll be like, no, don't do that, is like if it really seems, or I know that that is, like, not a good idea. Like multiple people would agree with that, or like it would be harmful, like those kinds of things. Like, we would have to think about that a little more carefully before jumping in. Yeah.
Yeah,
Mm-hmm.
yeah, yeah. Like the dangerous,
Yeah,
the
this
danger
is
zone of
actually
things.
harmful. Potentially.
Yeah,
Yeah. Mm-hmm.
yeah, yeah.
So
That's that's great. That reminds me, actually, if we have people
mm-hmm.
with neurologic disorders or chronic health conditions that have joined us here, one of the things, because we do very much believe in a person kind of having the right questions to ask, we actually have a little guide. It's almost
Mm-hmm.
like a little book that I created of questions to ask providers, particularly if you're looking for kind of a whole person approach to what's happening for you. Maybe one approach, and this kind of gets back to this article too, maybe a purely biomechanical approach was not really successful for you, because you're more than just physics in your body. You're like many things. And that was one of the themes that came up. But anyway, I was going to tell you, you can go to reactivept.com, and right on our front page, we have a download, and you can get that guide. I think it's 9 questions you can ask a rehab provider to get that information from them and find a good provider for you. That was a side note.
Mm-hmm.
But one of the themes that came up was the explanations, like you said, that a therapist might have given. So most people in the study had worked or were working with a physiotherapist, and they had gotten a lot of kind of biomechanical pieces, right, of it. Some person even said, well, I thought it was stress, but my therapist actually said it was all my posture. My posture was all wrong. It was how I was sitting at my desk. And I found that really interesting. Like, here, this person came in with like, I've just been really stressed. And the therapist came in and like, your posture sucks. And now the person's going like, stressed? Is my posture, terrible? What do you
what do you do?
What do you do with that?
Okay.
What do you do, Brittany, with those?
I know, because I've been
pieces.
And that I have to say, like, imagine how frustrating that is, like, as the person, like, getting so much different information. I think it kind of goes back to like thinking about like the sense making process, and I feel like that's like an opportunity to help people start walking through that process and coming to the answers that makes sense for them. Because I think that's another piece in this article, is if there's conflicting stuff, it's just not going to go over well. And like, also it might lead to issues with having difficulty with coping, because now, like, the other example in that was like, I mean, if it was like the posture thing, it's like, oh, and then I didn't do my exercises, so now it's all my fault that my neck pain, right? Like, now we're like developing a new narrative, right? And so I think as the healthcare professional, and in those experiences, what I'll do is like, let's look at the data, like, let's test it. Like, or like, so you could, if you have like, well, these days I was stressed and my pain was higher those days, that's a correlation. Like, maybe you should explore that, right? Or if it's, but also that same day I was working 14 hours editing a video on my computer, then it's like, okay, so like, why don't we like, let's like make it an experiment and say, well, if it's really the sitting, like, we can't maybe change the stress right away because for whatever reason, but what if we change the variables that we can control? So it's like, let's change you to a different type of desk setup. Let's try more frequent rest breaks. Let's try, like, mindfulness integrated in that. I don't know, right? Like, you can just toy with it and see what is the bigger piece of pie. And then I think this then points back to helping the person do their own little pie chart. Like, what do I believe it is? And then using like your exam and using your treatment experiences to kind of create an evolving pie chart over time, and seeing if that sense-making process maybe even changes through working together. Yeah.
Right. You just gave me like 500 ideas for the next research study we need to do, because I think this idea of sense making with a patient doesn't lend itself to a randomized controlled trial, right?
Not at all.
Because what we're saying is, for the person who is making sense of their pain as primarily a biomechanical like piece, and maybe there aren't other factors like that, therapy, that exercise approach is going to work really well. But for the other person where their dog just died and they're going through a lot of life stressors, and they slept wrong and their neck has been terrible for the last 40 years because of it, they're not making any biomechanical sense out of it. Now, there might actually be some biomechanical changes, and you can come together with those, but that person in like situation A and B don't even belong in the same randomized controlled trial, right? Like, they belong in the trial where we make sense together and we treat as like a journey, right? Together. And one of the things, so the way they set up kind of outcomes with this were themes and sub-themes, right? Whether they were causes of the pain, provoking factors, their identity that maybe has changed with living with this pain, the consequences, how controllable it was or not, the emotional representation. And I think this is where I feel kind of lucky in a way that most folks who come to Re+active, because we provide a whole person integrated care model, they're actually looking for that whole person sense making, right? Whereas if we were a purely manual therapy clinic, I think we would find that we have folks that are kind of looking for that particular approach, right? Now, honestly, some folks apply or call us and I go, you should actually go see this manual therapy. Like, not that we don't do manual therapy, but that is all that's like most of what you are sharing, that your belief is about this picture. I actually think our whole person approach is going to not feel great for you, right? It's not going to fit your needs, and I think that's okay. Every person has a different need, but I feel lucky that we have an integrated team that can kind of zoom out bigger picture, because people shared things, particularly I was looking at kind of the like emotional representation, feeling, one person shared they've really cut off socially from their social network, and that was something they identified as like part of like the downfall of this, but also likely something they want to like continue. And I think, oh my gosh, you should work with our OT and psychology team and like find ways that you can get back safely to some of those activities, right? Yeah. I know, again, I'm looking at this article and we could probably talk for a couple of years
I know.
all of my highlights. And again, I'll put it in the newsletter, but was there anything else in here, Brittany, that you're like, this is another one?
Oh, okay. I thought you were going to go for another one. I was like, oh, what is it? Okay.
One more for you. I feel like I have many things to share.
I mean, we've talked a lot already about this, but I do like their kind of like implications for clinical practice with, I think, really calling healthcare professionals to kind of up their game in what person-centered care really means, and then really trying to understand that person, their thoughts, their feelings, like their narrative of what's happening to them, and then also validate their current coping strategies. I think we like are sitting there trying to like fix everything, it's like, but like I think it's also important to like really celebrate how hard someone has been working to help themselves, and also just like the challenges that they've been through, and just like acknowledging how hard that also is really important. And I feel like, patients and people who come to see us just like don't get enough credit for like the work that they do for themselves. That's all I would say in the end there. But also there's like another study kind of like hiding in here, like they referred to. I'd love to like read that one, and maybe we could do another live on that or something, but it's like in the beginning.
Okay.
So
stay tuned. And I know we titled today Pain and Perception, and because that's in the title here. And what I love about this implications for clinical practice is that call to really explore a person's perception of pain, and continue to facilitate. I think this actually goes alongside really well. I went to a talk on ableism this week, facilitated by USC, and because so many healthcare professionals are in a fixer mindset, we actually kind of miss a person sometimes and their perceptions and the great ways they've managed to cope, because we're like, well, we just need to fix this. And some of that comes from an internalized ableism that a person needs to be fixed, and that they have to have full
Yeah.
range of motion of their neck all of the time. So, not that I don't value that, I do. But I thought there was a really nice overlap of themes here in general. And I know this is a big part of our Brain Bites group and our complex case masterclass and all of the teaching that we do, is a big mindset shift for therapists, is to move from being a fixer to being a person on a journey, in a relationship, in a more of a coach perspective. And a big part of that means really understanding that person and their perception. So we might have thrown people off by our title, because I think sometimes people think perception and they're like, oh, you're going to tell me it's all in someone's head, or you're going to say their perception is what's causing the pain. That's actually not it, right? So I think that's what's so lovely in this article, is actually that the point is just listen.
Yeah.
Like, just understand and take in that person's perception of their pain and how it's impacting their life. So so lovely. You know what, maybe we talk about this again when it gets published, because again, it's in review. And again, the article was illness perceptions in people with chronic and disabling non-specific neck pain, a qualitative study. Really, really lovely themes that influence all of us as clinicians. I'm just going to go double check. I think I was just looking to see if there were questions. One was for the article, one was a hello from my dad, and another hello from Australia. Thank you all so much. We appreciate your questions, your comments, your input. Keep sending me messages, and we'll keep sharing what we're learning and doing every week. And go get on our newsletter, reactiveeducation.com. If you're a clinician, I'll send out the newsletter with these videos and articles and all of the great things tonight. And then on Monday, if you join us, reactivept.com. If you're a person with a neurologic injury or chronic health condition, join there so that you don't get all the emails for all the clinicians. You get your own, and we talk specifically to you, and I send out the newsletter to you there. So thanks again, Brittany. This was really fun. And we'll see you all later. Bye.
Bye.